very informative talk about how to regarding application process. I know some of the audience that just got ECFMG certificate, or they're going to apply this year, or did not get a match this year. Those are the information you want to get from the standpoint of the program director. Okay, so next, it's our great honor to invite another program director, Dr. Jorge Kong. He's a program director in surgery residency at Westchester Medical Center. He is also the associate professor at New York Medical College. Dr. Kong is actually an IMG. He grew up in Costa Rica, and about 4 generations ago, his grandparents immigrated from Guangzhou to Costa Rica. He went medical school in Costa Rica and came to US, applied for residency, pursue his dream as a surgeon. Now he's a program director. It's our honor to invite Dr. Kong. Thank you.
Thank you, Dr. Zhu, for that kind introduction, and thank you, the Association for Chinese American Physicians, for the invitation. I hope I'll be able to join you in future meetings as well. Thanks, Dr. Stephen Kai, for introducing me to the group. So Dr. Chu mentioned I am a foreign graduate, so I'll try to give you my input on how it is, how hard, or how you can get into general surgery. This is the clicker. So some of the information I'm going to show is going to be publicly available. So this is from a survey that was given by the National Residency Matching Program, the NRMP, to program directors in surgeries, of the survey from 2020. So in it, they asked the top 10 factors to all program directors, what do you consider to offer a candidate an interview? So this is not for foreign medical graduates, for all medical graduates, right, including US graduates. You can see that up there, number 1 is the step 1 score. So really, that's the only thing that distinguishes one candidate from another. When we're talking about apples to apples, people come from different institutions who have the grades are different. So this is everybody takes the same test and the score is the same. Now the challenge now is that this pass or fail. Step 1 is pass or fail. You know that, right? So probably step 2 will be the key for a foreign graduate. Letters of recommendation, personal statement is 4, clerkship grades in the specialty, but all clerkship grades are a little different depending on your institution. Then they name professionalism and ethics, leadership qualities, other life experiences, grades in clerkship, and commitment to specialty. Right. So this is how the program directors screen for who they're going to give an interview, and I'm going to share a little bit of how we do it at our institution and what the competition is like. Now, once you do get an interview, then the program directors get asked, what are the factors that get you ranked in your program? So like you can see, the top ones are just going to be about your interaction, either virtually or in person. So number 1, interaction with the faculty. Number 2, interpersonal skills, which is really about interaction. Feedback from the residents, interaction with house staff. Step 1 is still important. Perceived interest in the program. Letters of recommendation. Step 2, leadership qualities, professionalism, and ethics. So once you get interviewed, a lot of it boils down to how you did the interview, how you interact with the program, and how they think you will fit within the program. So the fitting is a very important thing. So let's go through all these items. Step 1 and step 2. This is also from the NRMP website. So this is for all USMLE applicants, right? So some programs in surgery, they will have a cutoff. They won't look at your application unless your step 1 is over 230. That's the ballpark, the cutoff. So this is for all applicants, including US graduates. When you look at the US graduates, it's about the same. So the size of the circle is the number of people who match, and then you can see the percentage that matched, right? So once you get below 230, it lowers. drops a little bit below 220, it gets a lot harder for even for US graduates to match. When it comes to foreign medical graduates, it's a lot harder. You can see that the match rate is a lot lower, about 20%. And really, for people to distinguish themselves and have a little bit higher probability of matching into surgery, you essentially have like near perfect USMLE scores, like 250 and above. This last dot. So it's a competitive a world out there. So that's for the USMLE steps. Letters of recommendation. How do you go about it? What's the system in the United States? I think a lot of it has been talked about by Dr. Beekman. So everything that she said, I think, is appropriate. In general, who writes a letter for somebody applying to surgery is going to be surgeons, right? The majority of the time it's going to be a surgeon. Why? Because if you have somebody from pediatrics, somebody from internal medicine writing the letter, what the programs are going to think is, is this person really interested in surgery, or why could they not get like 3-4 letters from surgeons that you have worked with? Now, the challenge is, I sometimes get approached to write a letter for a medical student. The medical students in the United States, they rotate maybe 6 weeks, 8 weeks, something like that through surgery. And then they'll spend like 2 years on trauma, which is sort of my field, 2 weeks on vascular surgery, 2 weeks on transplant. My schedule is I spend 1 week on trauma, 1 week on ICU, 1 week doing program director stuff. So I only interact with the student for 1 week, and then I have to write a letter for that student. So a lot of the letters are going to be sort of basic letters. There's a good student, they did well on the rotation, writes a good H&P. And you, as a letter reader, you can distinguish. You can easily read through when the writer does not know the student well. So sometimes you also need somebody who knows you well. And for all of you applicants who have had some time doing research, sometimes your research mentor is the person that you want, for sure, to write you a good letter. We understand that sometimes they're not surgeons. Sometimes the research opportunities are not necessarily in surgery, but if you've done something significant with somebody, make sure that that person writes you a letter and explains that, all the time that you spent with that person, the different projects you may be asked at your interview, what your research project is about, where you presented it, did you get to publish it? People want to see that trajectory for the academic work. A lot of times when you're a foreign graduate, then you're going to help your letter writers, right? You have to help people translate the letter or so on and so forth. So a little bit of how the letters are written. The reader will not know who the letter writer is if they're from another country most of the time. Sometimes you will have the luck of working with an internationally renowned faculty, and that's a different story. But a brief introduction of who the letter writer is usually appropriate. I usually start my letters by saying, I am the program director. We have 20 residents that graduate, 27 total, including the preliminary. I've been in this role for 7 years, and we have graduated around 30 surgeons. Any given year, I interact with about 80 medical students from New Medical College. And this student that I have worked with is among the best, et cetera, et cetera. Some keywords, sort of just adjectives sometimes can be seen as a little bit, fluff. What does that mean? That they're excellent? Everybody's excellent in the letter, and most of the letters that we read, right? But if you can show how good the candidate is in some way, a little bit more objective, it always helps. There's some talk about keyword, especially amongst faculty in the United States. We're actively recruiting this candidate to our program. If they really meet it, it really sometimes carries a little bit of weight. But if they can describe, you're the best students in the class of 120, all right, or the best 5 in the class of 120, that carries a little bit more weight. Or especially they can say you're the best student in my last 10 years, that carries more weight. And then the letter writer can also highlight some of the other things that you can find on your CV. It's about, repetition ensures that the interviewer or the program, does not miss the details. Like certain awards that you receive, have the letter writers reiterate that you got that award and what it means. And there's nothing but no substitutes for substance. So if the letter writers really knows you and knows what you have done, and can speak to research projects and how you got to work together, what you did, how you presented it nationally, and that you got an award, and that speaks volumes, right? And then you move on to the next project. MSPE, Medical Student Performance Evaluation. Many times, if you are a foreign graduate, outside the United States, this document does not exist. You have to help your medical school create this, and you have to translate it, right? If you're in the medical school in China. So what is usually in this document, and how is it different from the transcript? It's not just your grades. So it usually provides a little bit of a narrative of how you did in school or who you are, some unique characteristics. Sometimes people have done things prior to medical school, they'll highlight it. Somebody has a PhD before getting to the medical school, they will highlight that, right? If you are the president of the student association, they'll highlight that. It also provides official academic handoff for candidates who have some issues. So people who had remediations, probations, so gaps during their training, they'll highlight it there. They'll explain the grades. The grades, even the American institutions, they vary. Some of them are pass, high pass, honors. Some of them are A, B, C, D. Some of them have a numerical grade. Some of them are just pass or fail. So how do you make sense of all different grades in medical school when people use a different scale? They sort of explain that in the MSP. So many people got a pass, or people got honors, etc. There are institutions where half the people got honors, so maybe that carries a little less of a weight. Sometimes they offer a class rank. So I think, like everything sort of numerical, sometimes it appears that it may be a little bit more objective, right? You're in the first quintile, or maybe you're the first of 120. I mean, that speaks volume. They sometimes mention whether you're part of the AOA, which is the American Honor Society, Medical School Honor Society, or other honor societies, Gold Humanism Society, etc. So they mention all these things. So just know that this is a document that does not exist. It often is substituted by a letter of recommendation from the school, when it comes to international graduates. But these are the information that's usually there. Personal statement. Some candidates have a compelling story of why they want to do surgery, but the majority of the people don't. You just you went to school, you did well in school, you did well in the test you have to take. But everybody has to explain why you want to do surgery and not another specialty. I think in surgery we say that the easiest thing to teach a resident once you get accepted is the technical skill. That part is easy. You can teach a monkey to operate. The next easiest thing to teach is for people to regurgitate the knowledge in medicine. You give them a test, you have to practice enough, people will be able to regurgitate that. But the attitudes towards surgery, your motivation to become a surgeon, your ability to work hard, long hours, that's the part that's harder. We think we can figure it out in the 30-minute, 15-minute interview, or by reading your personal statement. But that's what people are trying to tell. Like, are you going to be a good fit for the specialty? For foreign medical graduates, I think one of the things you can talk about is how is the medical system in your country? How is being a surgeon in your country where you did your training? What were your experiences? And if you think that there's a difference with the United States, that's one of the things you can talk about that maybe the US graduates cannot. But some people do have their own compelling life story because one family member underwent surgery and so on and so forth. So those are also good things to put in a personal statement. Grammar, writing skills for those of you who are not for whom English is not your first language. Consider also a professional review, right? There are some companies that offer, professional writers whose first language is English. They can review your writing, and it's okay. It's okay, I think. Avoid controversial topics, anything political, anything controversial from your country regarding surgery. Try to avoid those. CV. It's pretty standardized. When you go through the ARIS application, you essentially fill in different sub areas, and you try to develop them in some standardized format. Essentially, I think it boils down to one thing: publications, publications, publications. So this is the place where you want to name all your publications, list them if they're PubMed. Even if they're not in the English language, name them there because it'll make a difference. You will also want to list all the attendance of national meetings and presentations for those of you who've been in the United States and had the opportunity to do that. And then sort of probably lower on the list is sort of your experiences. Just know that the things that you list are fair game for the interviewer to ask you about. So if you're going to write some fluff or something you cannot talk about, that may not carry so much weight. It may work against you, right? So if you ran some marathon and then you don't have much to say about it other than you ran the marathon, then think about where you're going to put it. If you actually put some work into it, organizing a meeting or so on and so forth, then do list it. Now the interview, we talked a little bit about it. Most of the people wear a black suit. If you wear brown like I am, then sometimes you stand out in person, right? You may not want to be the person who stands out because you already stand out as a foreign graduate. When it comes to the interview, you want to be seen as every single other candidate, at least until they interview you. Every interviewer is a little different. You don't know what the interviewer is going to look for. So you need to have all those things that you reviewed, sort of the personal statement, know who wrote your letters, know about your research, and be able to talk about it, because they will ask about different things. So I'm going to describe the different faculty that work with me. One of them, I call her him or her, the LOR reader, letter of recommendation reader. Why? Because this person worked at different institutions in New York. She trained in New York. And then she knows most of the applicants to our programs are going to be from the region. So she knows most of the people who wrote the letters, and she knows, well, this person says that they're excellent, it means that they're really excellent. It means that, we want to recruit them, it means it's good. Or she will say, well, this letter writer always says that everybody's excellent. And I don't give that much weight to their letter. So that's one of them. Another of them likes to ask them about research, but also likes to ask about the personal state. So he reads about those things. Most people will try to see the trajectory, how people went through, whether there's a big gap and what you did during that gap, or there's no gap and it's just a check mark. And then, I'm somebody who tries. This is the last one is sort of me. I ask the candidates most of the time, tell me where you see yourself in 10 years. I want to see what you want to do. I want to see if our program is a good match, what you want to do. I want to see, what subspecialty you want to get into, because that allows me to tell you, hey, we're a good match because we've had a good experience matching people into surgical oncology, pediatrics, maybe not pediatric, etc. Right? I think it's okay to write a brief thank you email. Don't expect a reply. I think like nowadays I get maybe one mail in thank you card, and I think you'll probably don't need to waste paper in the more environmentally conscious sort of present. Then there's the informal interview. If some of you applicants have the opportunity to go to national meetings in the United States, just know that these are informal interviews, right? If you go with your mentor, you're presenting at a national meeting, and then your mentor knows some other people from other institutions, maybe they work over there, and the meetings are all about getting to see people you don't see all the time at work. So you see your old colleagues and the people you trained with in the past, and then you're going to have dinner with them. You may not know too many people, but you met the faculty from another institution. That's an interview. And when you get to apply to their program in surgery. You already met them at the Academic Surgical Congress or the meeting for the American College of Surgeons or one of the trauma meetings in my world. It changes you completely. And they're going to remember you. Oh, you're the medical student who presented, the foreign graduate who presented at the American College of Surgeons. You're not just the foreign medical graduates who's applying, but that may even just get you the interview. The interview is not just the faculty, the coordinators give feedback, the residents give feedback. It's about your fit. So you're getting interviewed by everybody, either via Zoom or in person. And sometimes these matter more than the real interview. Other considerations, research years. Many foreign medical graduates have perfect USMLE scores, above 250, 260. If I wanted to fill the 4 categorical positions I have with people with just perfect scores, I could just pick it from foreign medical graduates and not look at anything else. Some of the candidates who have spent 2 or even 7 or even 10 years doing research in the United States. That's just the reality. There are people who are willing to spend that much time doing research. They finished medical school. They had an opportunity to do research with somebody else. These people will have a whole lot of presentations at national meetings in the United States. They will have published at US journals, and they're applying for general surgery. Some people will have an advanced degree, a master's degree, PhD, etc. Some people will have done residency before, and they're willing, in another country, they're willing to repeat it. So, think about the competition for foreign medical graduates. But little thing about the degree, it's sometimes not about the degree. It's not about you having programs, they see you have it, so good for you. But more important than the degree is the ability to publish in the field you're going into, meaning publish in surgery. So I think if you have a little bit of a portfolio of publications in general surgery, that carries a lot more weight than a master's degree from Johns Hopkins and no publications, because we've had research fellows who have a master's degree and after a year they were not able to publish. So that's not the person we want to get. So nothing better than to have shown that you can do what in the academic surgical field is seen as success. The currency in academic surgery is publications. And that's what the faculty care about, because your publication as a trainee is their publication, and so on and so forth. Preliminary years, sometimes as a foreign medical graduate, you start off as a preliminary resident, and you have to decide, if that's the right step and if it's the right time to do that. It might be, the way to get into a categorical position in general surgery. So the preliminary positions are divided. They're all the same, but the candidates are divided into 2 groups: designated preliminary and non-designated preliminary. The designated preliminary are those going into other specialties like anesthesiology or radiology, who have to do 1 year of general surgery. There used to be a lot more programs that require that. Urology, orthopedics, neurosurgery, they all used to have to do 1 year of general surgery. That's not the case anymore. There are very few specialties that require a first year. Even anesthesiology, now there are programs that just take you from the first year, PGY1. So there are fewer designated preliminary positions. Having said that, I think that in general, the number of preliminary positions is about the same, maybe decreasing slightly. So in general, there are more preliminary positions than there are US graduates. So many of these preliminary positions will not fill, and they have to fill through SOAP, the supplemental matching process after the real match. And it's a window for foreign graduates to get into it. But know that it sometimes closes some doors. If you're considering different specialties, doing a PGY 1 year, something opens that door, you have some US experience. But once you do a second year, and sometimes the surgery programs have second years, preliminary positions, you sort of show your cards a little bit, that if you're willing to do 2 years of surgery, you're probably not interested in other specialties where maybe, you may be more likely to match into that, where there are more foreign graduates matching into these specialties. But also in surgery, sometimes there are openings at the PGY 3 years. So then who are we going to pick? We're going to pick people for preliminary PGY 2, right? So there's a narrow window to get into categorical positions. Why do we have these openings? People do leave on research in general surgery. Some programs have a mandated research year, and then they typically leave by PGY 2 or 3. I prefer that they leave after PGY 2 because they come back to PGY 3 instead of PGY 4, where they serve almost as chiefs. And then, surgery in the United States used to be pyramidal, meaning there were lots of people who started, but a few people who graduated. And then there's talk about attrition, 25%, 1 out of 4 people who didn't finish the training. I don't think it's like that anymore, but there's still attrition, and it usually doesn't happen the first year. Sometimes it happens a little further on. If you are offered a research spot, let's say you are preliminary or before a preliminary position, at a certain program in surgery, they're offering you a research spot. No, but sometimes that's a way to get into surgery, especially if you do well doing research, right? Observerships in the United States, they're helpful. I think having none is difficult, but sometimes it depends on what the institution. My institution rarely offers observerships to international medical graduates. Sometimes it's easier to have an observership with a private practitioner. There's less loopholes to go through. You don't need the institutional approval and a badge and get into the hospital. You work with a private practitioner. Sometimes there are just opportunities that are just there. I'm a foreign graduate from Costa Rica. I speak Spanish. There were U.S. medical schools who sent students to Costa Rica for medical Spanish. There's an exchange program that they had. So I was able to come to the United States to academic medical centers that, just an exchange. So they went to Costa Rica. I was an exchange student here. I went to Boston and Louisiana. There's a category of foreign medical graduates who are already trained in surgery. The surgical training is different in different countries. It could be 4 years. Sometimes it's 3 plus, but then you're not really faculty until you do another 3 years of practice. Just all that counts. If you're board certified in your own country, you know that there's some other pathways to become a surgeon in the United States. Sometimes the fellowships may take you, right? Transplant fellowships are known to take people without training in general surgery in the United States, sometimes critical care. You have to look into what the requirements are to get into those programs. Now, if you finish the fellowship, sometimes you're not qualified to practice with unrestricted in the United States. You still have to do the residency to have unrestricted, to be board certified and have unrestricted practice. But sometimes you are a different candidate once you already have a transplant fellowship from UT Southwestern and you apply to general surgery. You're a different candidate than the usual foreign graduate or even a foreign graduate with surgical training. You have to think about the visa duration if that's what you're doing. If you're on a J1, it's about 7 years maximum. So do the math. There's a little bit of leeway, and then think about whether you want to repeat residency training. Right? If you didn't have a great time doing residency training, you want to repeat it. Maybe you don't want to do it. So it takes a specific person who wants to do that. But the training can be a little different. Another thing to think about is where you're applying. Are there any foreign medical graduates in your program? This is where I share, our institution. So Westchester Medical Center Westchester is about 30 minutes from Grand Central. You take Metro North up, that's where hospital is. We call it sort of the flagship hospital, about 900-bed hospital. We share the campus with New York Medical College. We're level 1. We have transplant, etc. We see ourselves at the quaternary referral center. I think we cover between Yale, Albany, and us. We cover all this area, north of New York City. And a lot of the patients that we see are transfers because they really don't come to New York because of the traffic. And that's who we are. I'm the program director, and I'm a foreign graduate. My former chair was also a foreign graduate, so that gives you an idea of whether we are friendly to foreign graduates. It's important to see that. The best way to tell is probably just look at the list of residents and figure out if because some very prestigious institutions like the Ivy Leagues, it's going to be hard for U.S. graduates to get into them, right? So the foreign graduate will be even harder. Everybody wants a surgical degree from Harvard, but the reality may be a little different. They may take a few exceptionally trained candidates. So how is it at Westchester? This past match cycle, we had 1,349 applicants for 4 spots. 814 foreign graduates. How does the program read or go through all the applications? Read 814 or times 4 letters of recommendation. You just cannot, right? So we screen through them. We offer about 100 interview slots. Most of them are US graduates, a great majority of them. The foreign graduates that we do interview are usually recommended by someone, or we met them somewhere else at a meeting. We have 4 categorical positions. 2 of them are a 5+1 research track. They spend at least 1 year doing research, and that's a commitment through NRMP. Sometimes they spend 2 years doing that. 2 people just go through the normal clinical years, 5 years. And we offer 5 preliminary positions between the designated and non-designated. So our categorical residents are typically 20, 4 graduates per year. And we have 1 foreign graduate per year. That's a good number, 25%. What's the profile of the foreign graduates? They have near perfect USMLE scores. They have 20+ publications by the time they apply, and these are publications at, in the United States, right? They have about 2 years of having gone to national meetings, in the United States. So, and the good news is that once they graduate from our program, our graduates are not seen as foreign medical graduates anymore. You're always a foreign medical graduate, but when it comes to applying to competitive fellowships like surgical oncology, pediatrics, they actually do well. The foreign graduates particularly. Why? Because they distinguish themselves from the U.S. graduates because of all this. They have 20, sometimes 40 publications by the time they're done. And the academic fellowships, they look at that positively, and they think that they're well qualified candidates for their specialty. And some of them go into academic medicine, some of them go into private practice, but that's how they get to do it. So I'm happy to answer any questions you may have. I have a CV of some of our trainees, a sample CV, and I'm not going to say it's just from one of them. The name is redacted. You can take a look at what our trainees have done or what it takes to get into surgery and compare it to what you have. I'm not showing it because it's obviously on somebody's background, on somebody's CV. Our contact information, feel free to reach out. And thank you again for the Association of Chinese American Physicians and the Alliance of North American Chinese Physicians for their opportunity to share this.
Actually, we have one question from Zoom. So we already have about 80 participants from Zoom. So this question is asking about the rotation, promotion rotation from program direct standpoint, is it good enough for the rotation, promotion rotation and the letter from the?
刚才考了双面人那个。
Commercial rotation, a letter is better than no letter. If it's in the United States. I think it all depends on what opportunities the person has. But I think first and foremost would be rotations at an academic institution with a residency program. And if you have an opportunity to do that, then people know that a letter writer who maybe is faculty or an academic surgeon. That's what the reader. That's what the reader is, right? So then the reader may even know the letter writer. That makes a difference. I think that clinical exposure is second. So if that's not an opportunity for the candidate, then the clinical exposure would be good. I don't know what commercial rotation means, whether you're sitting at the desk, the cashier at somebody's front desk of somebody's private office, or what that means, right? So
most common for like internal medicine, so you get the commercial rotation and you follow attending, and sometimes in the office, sometimes in the hospital, and surgery maybe.
Yeah, so if I understand as commercial rotation being following a physician in a private practice, I think those are helpful because it tells you that the candidate has seen patients in the United States, have been involved, especially if the rotation is followed by a significant letter of the patient's involvement, or the candidate can talk about what that rotation means.
But most of the commercial rotation, maybe the letter is like a template. It's not really well.
Well, and that's where the candidate has to be smart about you have to guide your letter writers to give the right information in the letter. You only have opportunities to submit 3 or 4 letters, right? And make it count. Make it count, and make, like, if you're the physician that works in private practice may or may not write too many letters, and they may not know how to write them. And it's up to you to figure that out and to guide them into your right there. That's my best advice.
Thank you. Any?
So I have a question about the prenatal surgery. So for example, would you consider people who apply for the second year, like for prenatal surgery? This is kind of if you mention anesthesia, you mention radiology, and like what kind of qualities you're looking for when we do prenatal surgery?
If you want to go into radiation oncology, do we consider you in general surgery?
Yeah. So,
sure.
But is it like the requirement for the quality you're looking for? Is it the same as if people want to do general surgery, or like the
I think I understand the question. So you're interested in radiation oncology. The question is, would I consider somebody who goes into radiation oncology for a preliminary position? Short answer, yes. And especially if you already matched into radiation oncology. Surgery internship, we don't expect very much of, we don't expect people to have like knot tying skills, or we don't expect you to be able to operate. That's not what the surgery first year does. It's very far from that, actually. So we don't expect every person doing the preliminary year to want to do surgery, right? That's why we take people going to anesthesia, radiology, etc. But I'm going to share a little bit of the, of how it is from the program side. All the people who matched into anesthesiology, radiology, radiation oncology, the program doesn't have to figure out what you do after you're done with a year. You already have a position. So these fit into the category of the designated preliminary. And most programs look favorably, even if you're a foreign graduate. I prefer to have this person than the graduate from my own institution who has poor scores and maybe not so competitive matching into sometimes anything. Right? So if you're well qualified, you'll be fine. I actually have had preliminaries going to surgical and to radiation oncology. This person had been a fellow and had a master's degree, research fellow, foreign graduate. And the foreign graduates sometimes don't get picked because you apply, people look at where you graduated from. This university of people, I have no idea what that is. They don't even give you an interview. But once you match the first time into the advanced position, then you're a different category. You get picked in the second round. And this person couldn't change dressings in surgery. Said, I'm afraid of blood. It's okay, he did fine.
To segue into that, let's say you're equivalent PGY 1 or 2 that couldn't get into the categorical spot. What would you recommend these folks to work on so that they can get a spot at the PGY 3 level, like you mentioned?
The question is why you didn't get in. I think one of the things you need to think about is, am I competitive enough to keep on trying? Some people, keep on doing that and get into different fellowships, but you can potentially get into a non-accredited burn fellowship or critical care fellowship. You're eligible to fill critical care. You just don't get certified by the American Board of Surgery until you're board certified in general surgery, so you look critical care. I would advise against lingering around too much, right? Because then you become somebody who are 5 years out of training, you have that sort of a baggage, if you want to call it. And then other programs where you may have been competitive, you may not again, be competitive because people are going to say you clearly don't want to do, come into my specialty since you spent all this time trying to get into general surgery. So I think that's a moment to really think whether you should continue or not. But if you already did 2 years, then you show your cards a little bit, but you can still turn the train around and see what opportunities there are. I think for those candidates, most of the times I will try to tell them that it's more important to be board certified in something than sometimes pursue your dream to become a surgeon or an orthopedist. And we know that in the United States, everybody has a perfect, they're almost like presidential candidates, all of them, right? So think about what opportunities you have with the things that with your board scores and the things that you do. Does research help? Sometimes it does, but it's a double-edged sword. That's why I think that if you do research before, then by the time you're a PGY2, you have all this, it's preparation, right? You're a very qualified preliminary PGY2, and then they'll pick you. But the fact is that there are going to be more candidates for those PGY3 positions than there are positions. And then if you just didn't make it, how do you compete with that other guy who has 40 publications? I mean, it's hard.
Thank you so much. So I participate in this community, and we always feel like there's not enough surgeon, Mandarin speaking surgeon in this area. So even surgery residency is very competitive. We still encourage those young folks, so they're trying to pursue their dream in surgery residency. Okay, so our next speaker is Dr. Jin Xu. Dr. Xu was born in Nanjing, China, and she graduated from Southeast University Medical College. And then she got a master's